time I get to spend with you guys and answer all your burning, yearning questions. And we are talking about plastic surgery here today. And we can talk about any procedure and any stage of the procedure. So pre-op, the operation itself, post-op, post-op care, and of course, we can discuss, potential complications as well. But a couple of announcements. This is the second to last live of the year. So 2025 is coming up to a very quick kind of wrap up here. And so I want to make sure you all know that the next live, so a week from today, will be the final live. And as you all know, those have been following me for years and years and years, know that the final live of every year is where we present all our stats. We're going to talk about what is our complication rate, what is our revision rate, et cetera, et cetera. So we're going to be presenting all of our stats to you. I do this every single year, full transparency. I've never heard of any other plastic surgeon do this. But if you want to know exactly what goes on here at Pure Plastic Surgery, I encourage all of you to tune in for the final live next year. We'll be presenting all of our stats and we're comparing our stats to the national average. Okay? All right. But so I thought for the second to last one, that we should probably just kind of dedicate that fully to the questions because, for the last few lives, people have been like trying to get in their questions in, and then of course time runs out, and then people get upset. They're like, "Oh no, Dr. Earle, you didn't answer my question," et cetera, right? So today I'm not going to be presenting anything. We're going to be all about you, all about getting as many questions answered as possible in this 30-minute period. Okay, so. Today, don't delay, right? Don't wait till minute 25 to try to get your question in and then get upset that we didn't get to you, okay? So if you have a question, you start throwing them at us right now, okay? We have a couple there in the bank to get started, and then, I'm happy to answer anything that you may have. Last but not least, I'm super excited because today we did a rib remodel case. Last week we did a rib remodel case. And tomorrow I have another rib remodel case. We are rapidly becoming the #1 center for rib remodel in the entire Southeast US. All right. And it is going fantastic. The patients are loving it. So I just wanted to throw that in there. Okay. All right. So let's go. We're happy to answer any questions from Instagram, TikTok, and we have YouTube as well. But honestly, most of our questions come from Instagram and TikTok. And I want to say, Instagram people, the TikTok people have been more active lately. I don't know. I've been with you longer, but TikTok, man, they're on fire. So yeah, happy to answer all your questions.
First question. I recently got a tummy tuck. What does it mean to train your belly button?
That is a great question. So, probably if you ask around, not all plastic surgeons talk about this, but I do believe in that, which is you want to train the belly button. And that means that you want to kind of keep the belly button in that nice kind of little oval shape, which is what a natural belly button looks like, right? So as part of the process of trying to create the most natural possible belly button after a tummy tuck, I do ask my patients to start training the belly button at 2 weeks post-op. And that requires placing, it almost looks like a marble, but a little kind of sphere in that belly button. And there's one that I like to use from a company that's called Silogen. I'll just write it here in case you want to look it up. But it's called Silogen, and I think it's called like Silogen belly button sphere or something like that. And it looks, it's like kind of shaped like a marble, like a little ball, but it's made of silicone, so it's nice and soft, and it doesn't mess with your incision because that's the problem we've been having before. We were having some plugs that were actually a bit too harsh, too rough, too hard. And they were messing with the incision. We don't want that, right? So this sphere works really, really well, and I do recommend it.
Thank you. Can you get a BBL if you have medium amount of cellulite?
Oh yeah, you can certainly get a BBL. So you can get a BBL whether you have anywhere from no cellulite to more severe cellulite. So the issue is not the ability to get the BBL, but the issue is, having realistic expectations of how things are going to look. Because remember, a BBL, which means fat transfer, right? Lipo and then fat transfer to the buttock and hips. You are not going to be able to fix cellulite with that, right? So BBL does not fix cellulite because the cause of cellulite are these bands or septate, which are basically pulling or tugging on the skin, and they're connecting the skin to the underlying muscle. And so the way to relieve the cellulite is to cut those bands. And so simply adding fat to the area does not cut the bands. And so the way to do that is to use a special device, and I'll write the name of that here. It's called Avali. Okay, so Avali is the name of the device that we use. It has like a special little knife inside that goes and it cuts those bands and it releases the skin for that smoother look. You typically can't combine it with a BBL. You don't want to do it at the same time unless it's very mild cellulite. Okay, so usually you either want to do the cellulite treatment first. You can do cellulite treatment and then 6 weeks later BBL, or you can do your BBL, wait till you heal, 3 months later do your cellulite treatment. The good news is that the Avali, the cellulite treatment, is done under local. So it's a procedure that's done in the clinic setting. No need for anesthesia, general anesthesia, pre-op labs, or anything like that. It's just done very simple in the clinic. Boom, you're in, you're out.
How is the recovery for a reverse tummy tuck, and how are the results?
Great, so that's a good question. So reverse tummy tuck has been getting more and more kind of popularity lately. People are talking about it more. I think the reason people are talking about it more is because more people are getting lipo, and sometimes when you do lipo, you still have some loose skin above the belly button. Okay, so the skin looks great kind of below the belly button and everywhere else, but there's a little bit of loose skin above the belly button. And so the way to fix that is with a reverse tummy tuck, where we're going up, right? We're pulling up in this direction as opposed to your regular tummy tuck where we pull everything down. Okay. And so when you do a reverse tummy tuck, you are dealing with that skin above the belly button. You're typically not releasing the belly button or doing anything with that. That stays in place. And so you're pulling the skin up. And you usually, for the most part, when you're doing a reverse tummy tuck, you're also not dealing with the muscles, right? It's strictly a skin excision type of surgery. And so then the scars are tucked underneath the breast in that inframammary fold. And that's kind of how you try to hide the scar as best as possible. It works really, really well. It's one of the best treatments that we have if you have that loose skin above the belly button. So I do, if you have that issue going on, I highly recommend it.
Why do girls say BBLs have a smell? Is it based on hygiene?
No, that is based on, can I say, well, I'll say BS. That is based on social media hype and bullshit, right? It is not true. It's become a thing, right? It becomes a trend. People start sharing it, but it's not true. If your booty smells, that's just based on hygiene. It has nothing to do with whether you had a BBL or not. So if you keep the booty clean, it's not going to smell. And if you don't, well, it will smell. That's it. That's the bottom line.
What would you do if your patient had an implant displaced twice within a year? They are UTM?
UTM.
Not sure what that means.
Yeah, I'm not sure what the UTM part of it means, but if you're talking about breast implants, you're talking about where the implant is and if it's being displaced out towards the side. That's something that often happens. Typically, what you have to do, and if you've tried twice and it keeps doing that, usually it has to become a more complex surgery to revise that. So you have to do. There's a couple of options. One is to use a mesh. So you can use an internal bra type mesh, and you can tap that mesh along the side here or wherever it is that you need to hold the implant in place. And so by tapping, I mean you use stitches, right? So you stitch the mesh in place. It works like an internal bra, and it holds the implant where you want it. Okay, that's one option. Another option is sometimes you can change the pocket. So for example, if you started off with a pocket where the implant was above the muscle, you can then switch to a pocket beneath the muscle, create a whole new pocket which will hold that implant in place. Or sometimes you can do it the other way around. You can go from a pocket that's beneath the muscle to like the new pocket that I like, that I use a lot now, which is called a subfascial pocket, where the muscle stays down but the fascia comes up, which is that layer that covers the muscle. You create a whole new pocket in there.
Can you talk about risks when you do a BBL, like fat embolism?
Oh yeah, and I talk about that all the time. So I'm not sure if you know me or been following me for a while, but that is the scariest thing, right? People talk. That's where you hear all the horror stories about the BBL, right? The fat embolism, right? But the thing about the fat embolism is that it's something that can be very easily avoided. And how is that? I'm sure those that are following me know the answer to this, right? How do we avoid that? Should I give everyone a second to answer this or no? Well, in the interest of time, we're going to answer a whole bunch of questions. You avoid that by using the ultrasound. That's right. So you use ultrasound imaging to turn a blind procedure into one where you can see, and now you know exactly where that cannula is, where that device where we transfer the fat with, that cannula, you know exactly where it is. You make sure it's in that safe space between the skin and the muscle, okay? and therefore there is no chance to injure the big vessels that are going to cause the fat embolism. Okay, this is something that I'm a pioneer of this technique. I've been doing it since 2019. I have now well over 2,000 ultrasound guided BBLs under my belt, and I've had zero fat embolism.
All right, next question. I am 9 days post-op tummy tuck. I feel good.
All right.
I want to run to the store for a few items. Is that okay?
Oh no! Come on. I don't know what you mean by run to the store. You certainly shouldn't be physically running. That's for sure. So what I tell all my patients. So after a tummy tuck, you're typically not getting back into strenuous activity or heavy lifting for at least 6 weeks. Walking, yes, you can walk from day one, but you are initially going to be walking hunched over like this. And even at 9 days, you're probably going to be feeling pretty tight and pretty hunched over. So I wouldn't overdo it. And usually for my patients, you're typically not driving either. So most of my patients start to drive somewhere after 3 weeks as well. So I don't think you're quite ready. I know you're feeling great, and you certainly should be up and walking around the house, and maybe you can even go out and walk around the neighborhood a little bit. But you shouldn't be driving. You shouldn't be carrying anything heavy or doing any strenuous activity.
How do I get a consultation? I tried calling. I'm from Texas.
Okay, yes. So first of all, we take patients from all over the U.S. and international. Okay, so thank you so much for tuning in from Texas, and we'd love to have you here. And the easiest way to do that is to go to our website. Well, this is Instagram, this phone right here.
Mm-hmm.
Yeah. If you're on Instagram, just go to my bio, and there's a link right there to our virtual consultation form. Okay, or you can go to our website, which I'll put right here.
That's www.pureplasticsurgery.com.
And then you'll look for the virtual consultation button. Okay? So you can do it that way. For those of you that are on Instagram, there's a link on my bio. For those of you that are on TikTok, there's also a link there on my bio. So you guys can just directly do that. That's kind of probably the easiest thing that you could do now that you're on the platform.
Okay, next question. Do you see a scar for a lip lift?
So typically when you do a lip lift, you want to hide that scar. So where do you hide the scar, right? So you may or may have not noticed that someone had a lip lift, or maybe you thought they had something else done, because when you hide the scar for the lip lift, you're hiding it just beneath the nose, just underneath the nostrils there. So sometimes it looks like a little bit of the scar after a nose job or rhinoplasty. But anyway, it tends to blend in very, very nicely there. So the scar is typically not very visible at all. If you're a woman and you put a little bit of makeup on there, it's actually completely invisible. If you're a guy and you have a little bit of facial hair, no one's going to notice it either. So it's a great place to hide that scar.
All right, next question. Do you cut off fat with the reverse tummy tuck, or is it really only just 1 liter of fat removed?
So when you do a reverse tummy tuck, you know that the excess like skin and the underlying fat underneath there, that all comes out, right? That all comes out together, okay? And then you kind of put everything back together again. And then along with that, you can do some additional liposuction. Here in the state of Florida, the max that you can do or that you should do according to the law is 1 liter of additional fat removal via liposuction, okay? Now, this varies from state to state, okay? I know some people are like, well, that's not what they told me in Texas, or that's not what they told me in California. It's true. Every state is different. Every state has different rules, but these are the rules here in Florida. But what I've noticed is that not everyone down here follows the rules. And I don't know how you feel about that. Like, do you want to go to a surgeon that doesn't follow the rules? Like, does it make you think, like, what other rules are they breaking? Do you really have your safety as your top priority? I don't know. Here we follow the rules.
You did my BBL this week. Thank you.
All right.
Comment.
Hope you're feeling great.
Next is, I'm from New Orleans, wanting a BBL. How long would I need to stay in for recovery?
Great question. So if you're going to be coming from out of state or international, the typical kind of stay here is a week in total. So you have the day, you have to come in the day before surgery. That's your pre-op day. Then you have surgery day, and then you have to be here a minimum of 5 days after surgery. So that makes 7 days, which is about a week. Okay. Nobody should be leaving before the 5 days after surgery. Okay. That's for your safety, because if you leave before that, the risks are higher of complications and importantly, the risk of potential for blood clots. Okay, so you definitely want to be careful with that.
How long is recovery for a lipo 360? Also, what is the average cost?
So the recovery for a lipo 360 in total, let me put it that way. In total, is 6 weeks in the sense that you can't do any heavy lifting or strenuous activity or like head back to the gym until you're 6 weeks out. Okay. Having said that, most patients are back to kind of an office type setting, a desk job type job after about 1 week. And most patients are even driving after about a week. Okay. So if you have that type of work, or of course if you're working from home, you can probably even do it sooner. So that's the deal with the liposuction 360. In terms of the cost, I mean, of course that varies from place to place, varies from surgeon to surgeon. For me, for a full lipo 360 plus Vaser that's already included, plus also the cell saver as part of that, all included, all done here at a beautiful facility of Pure Plastic Surgery, is approximately $10,000.
Thank you. How long does the BBL surgery take? Also, how long does recovery take?
Right, so the BBL surgery, again, is going to vary a bit due to several factors. For example, the BMI. So typically, the higher BMI patients, the surgery takes longer. So if your BMI is, say, 22, it's going to be a shorter surgery versus if it's 30. Okay. The other thing that's going to change is what type of add-ons are there. So if you add additional areas, that's going to take more time. For example, the chin, the arms, or the thighs. The third thing that you may or may not add on that's going to also add on time is skin tightening. So if we add skin tightening procedures such as J plasma or quantum, that's going to add more time. Okay, so if I'm going to kind of like average everything else, so average standard BBL, so liposculpture 360 with Vaser and fat transfer for a BMI, say in the mid range of about 25 or 26, with no add-ons and no other skin tightening, that procedure is probably going to take about between 2 to 2.5 hours.
Thank you. This patient says, I've had fat removed from my lower lip. For a year, it's been tingly. Will this ever be normal?
Oh boy. So I mean, if it's still tingly after a year, you might want to consider trying some stuff to help it out. So I'm not sure. There's a medication that really helps with this type of tingling, what we call neuropathic tingling or neuropathic pain. It's called gabapentin. Not sure if you've been on that already. I'll write it down here just in case. And you can ask your provider to perhaps start you on that. Gabapentin, Lyrica is another one, and these can help with that type of pain, and maybe that is kind of like the little final push you need to make it go away.
Thank you. Let's see. If you decide, let's say if you know this, I think this might be even office based. If you decide to finance, does the full amount have to be paid before the appointment?
So yes, but not to the whatever the financing company is, right? So we work with several financing companies, and so what happens is that you end up kind of paying them on a monthly basis that's spread out through however long you want it to be. But the company, of course, pays us in full before your procedure, right? And so what are our options? We have Care Credit, we have Cherry, we have Alpheon. And I believe we even have one more, which I'm blanking on the name right now. But we have at least four different financing options that you can work with.
If I have a desk job, can I return to work 2 weeks post tummy tuck?
You could, as long as probably somebody else is driving. I don't know, for most patients, they're not feeling super comfortable driving just yet. They're usually comfortable driving after about 3 weeks. But other than that, then yes, you should be able to kind of go to the desk job. Like I said, as long as you're not carrying like a heavy briefcase or a heavy purse or stuff like that, right? You want to be not carrying anything heavy, not doing any strenuous activity. But if you're able to avoid all those things, then potentially you could go back.
How many massages should one get after BBL?
So I highly recommend at least 20. At least 20, okay? So I think post BBL or post lipo lymphatic massage is very, very important. Like I always say, the post-op care is just as important as the surgery itself. It's about 50% of your final result. Okay, you can have the most perfect surgery, and if you don't do your massages and if you don't compress the right way, you're not going to get that 100% result. You're going to get maybe a 50% result. Okay, so I recommend 20 massages minimum, and that is strictly the minimum. Some patients may require more. It's not unusual to do 25 or even 30 massages after your BBL.
Do you perform erectile implants?
So I don't perform that. I don't do urological type or gynecological type plastic surgery. No one at Pure does the urological type plastic surgery. We do have Dr. Vidal, and she'll do some kind of labioplasties and stuff like that. But yeah, we're very limited in that sense.
Do you use drains for your BBL?
I do. So I like to use a drain. I use a drain in the lower belly area. It's just the one drain, and it's there up until post-op day 5, and then we'll get it out. So you sort of get the drain out before you go home. I think it's just a better way to control that fluid, that drainage, everything that's coming out those first few days. And I also think that it helps the massage therapist, because when they're doing their massage, they can just push everything toward that drain, and then it comes out through the little tube, and it's all contained as well.
How long is recovery for a lipo 360?
So again, I think we just went over this. So total recovery is 6 weeks. However, getting back to an office setting or desk job and even driving is probably just 1 week. 6 weeks to get back into the gym and strenuous activity and heavy lifting.
Thank you. Can you give us the process of your consultations, the cost, and does that go towards surgery?
Right. So the consultation, we have actually 3 options to do a consultation, depending on what type of convenience you want, how much you want to you kind of pay for it, etc. Right. So we have our virtual consultation, which we talked about. You can go through the website, or you can hit the links in our bio. And the virtual consultation is 0 cost. Okay, $0. Now, if you're from out of town, right, different state, different country, you want to have a video consult with me, so us talking through the video, then that's going to cost $250. But those $250, if you end up booking, will go towards your surgery. So it's not an additional $250, okay? And then if you want to have a consultation here in person, well, that's going to be $500. But again, those $500 will go towards the surgery if you end up booking the surgery, okay? So it's not like an additional $500 to what you would have paid for your surgery anyways.
What can I take to help with swelling after my mommy makeover, tummy tuck lipo, flanks, and abdominoplasty?
Okay, so you had your mommy makeover, and so you're asking, what to do to help with swelling. Well, one of the things that's a little counterintuitive, that one of the best things you can do is walking. So walking is very important. I do expect all my patients to walk, and they should be up and walking at least 10 minutes every hour while awake. And then, of course, wearing your compression, right? So initially, if the drains are still in place, I put all of my patients in an abdominal binder, okay? And of course, a surgical bra for the breast part of the procedure. And then once the drains are out, then you can switch from that binder to a faja, okay? And then that surgical bra, you can switch that to a sports bra. So that's going to help with all the inflammation, and of course time. You got to give things time. There's really not a lot that we can do there. It is going to take several months for all that swelling to go away.
Okay, I know you may have touched on this a little bit ago, but we have 3 new questions about recovery for reverse tummy tuck.
Okay, all right. So reverse tummy tuck very popular today.
Yeah.
Nice. Okay. Like I was saying, it's gaining popularity. A lot of people are asking about it. I think a lot of people are asking about it because liposuctions become more prominent, and when you do lipo, sometimes the skin above the belly button remains loose. And one of the best ways to deal with that is with a reverse tummy tuck. And that's where you pull things up, remove all the excess skin, and kind of tuck that incision underneath the breast and that inframammary fold. The total recovery for that is going to be kind of similar to a tummy tuck. It's going to be at least 6 weeks of no heavy lifting or strenuous activity. You won't be going back to the gym till at least 6 weeks out. But there is no muscle repair, so that's a good thing. You don't have like that tightness there. So typically you're driving and stuff probably within 3 weeks, maybe a little sooner, and going back to like office type settings and desk jobs around that time as well.
Thank you. Do you need to take antibiotics for the BBL? If yes, how long do you need to take them?
Yeah, definitely. So I give antibiotics to all of my patients for pretty much all procedures. But yes, specifically for the BBL, you will get oral antibiotics that you're going to take for 1 week post-op.
What is the criteria that makes patients ineligible for Lipo 360?
Okay, so yeah, so what makes you not a candidate? So there's going to be some criteria which you can control and some criteria which you can't. So one of the first things are what's your BMI, right? So every surgeon is going to have a different BMI limit. But for example, my BMI limit is 30. So if your BMI is above 30, you're not going to be a candidate until you can get your BMI to 30 or below. But that's one of the things that you can control. If you can't, kind of achieve it on its own, we can help you as well. We can, for example, prescribe Manjaro, one of the GLP-1s, or things like that to get you to where you need to be. But then there's going to be things that, for example, medical conditions. So say if the medical condition is not controlled, then you're not a candidate. So if you have, for example, high blood pressure, hypertension, or diabetes, and it's uncontrolled, then you're not a candidate. However, if that condition is controlled, so you control your hypertension with your medication, or your diabetes with your medication or insulin, then you become a candidate, and we can do the surgery. Okay. And then there's things where you're just not a candidate. For example, if you have a history of blood clots, personal history of blood clots, well, kind of that makes you not a candidate for completely elective cosmetic surgery in the outpatient setting like we do here.
When can I stop getting the lymphatic massages? I got liposuction and BBL with Dr. Vidal a month ago,
Okay.
and I'm already on my 22nd massage.
Awesome. So if you've done the bare minimum, like I said, 20 is the bare minimum. And it really depends on the end point and the end goal. So, I'm sure you're communicating with your massage therapist. And at this point, you're probably doing them either like every other day or maybe even weekly. And so it's all about how is the skin looking? How is the inflammation looking, right? So if you've gotten to a point where everything's looking pretty stable, then you can start to kind of wean off the massages and be done with it. But if you're still kind of in progress, that you still have some inflammation, some swelling, or you still wanting the skin to retract a little bit better, then you should continue with the massages until you reach those goals. And every patient's going to be a little bit different. Just because your friend, let's call her Susan, just because your friend Susan got 20 massages and she was done, does not mean that you are going to get 22 massages and be done, right? You may need 26, right? Every patient's going to be a little bit different.
Thank you. Does J plasma really work? I heard it's temporary.
So no, I would not say it's temporary, but what you need to know is that the J plasma can only do so much, right? It's not the same as getting a tummy tuck. So if, say for example, if the degree of tightening that you would get from a tummy tuck is what we would call 100%, then the most that you can get from J plasma is going to be about 60%. Okay, so right, but tummy tuck, of course, is the most extreme option, and we're talking about a big surgery and big incisions and everything else. And the skin tightening is less so, right? That we can do at the time of Lipo 360 or BBL, but you can't expect the result to be the same, right? So tummy tuck is 100% skin tightening. J plasma or quantum is about 60% skin tightening. And then the other thing is that you're going to see that that progress, or it's going to continue to get better over the course of the first 6 months. Okay, so for the first 6 months, you'll see that progress. Progress and continue to improve. Okay, but once you kind of stabilize at 6 months, that should be kind of the way the skin's going to be for a very long time. Of course, at the end of the day, age always wins, right? But it should stay there pretty tight as long as you maintain a healthy lifestyle for several years.
How soon after round 1 BBL will you do my round 2?
So the soonest would be 9 months. Ideally a year, but the soonest should be 9 months.
How bad is the pain of a BBL?
That's going to vary tremendously. I've had patients where they're in recovery smiling and they're like, "Doc, did you even do the surgery?" Right? And I've had patients that are just like screaming in pain. Honestly, I've had the whole range. It's going to depend on the patient, really, because I do the surgery the same tools every single time. If you're someone who maybe has never had any sort of surgery and never even given birth or anything in the past, you may feel it more intensely because you've never gone through something like that before. Typically, patients that have had a prior surgery or have had multiple kids, they tend to do better because they kind of know what that type of pain is all about. But again, it varies a lot from patient to patient.
Hello, doctor. How involved are you with pre and post-op?
So I'm very involved in the sense that I know about everything that is going on. Okay, but I mean, I have teams that take care of all these things as well, right? I'm one person, and if and I'm doing, I have several patients to take care of, right? And for that reason, we've created fabulous teams who have, great team members, and we've grown a lot. So, if you had surgery with me back in 2019, we were probably 7 people. And now we're about 35. So we created these great pre-op teams, great post-op teams. They know they are super knowledgeable, and they'll take really great care of you. So how am I involved? So obviously, when you come for your day before surgery, that's pre-op day. Okay, that's the time to spend with me. We're gonna spend a lot of time together going over your goals, your vision, making sure that the expectations are realistic. I'm gonna be answering all your questions. So you can come for pre-op day, make sure that you have all your questions with you. Okay, because that is the time to ask all the questions, and we'll answer them all. We'll go over your basically your plan, and we'll get everything ready for the next day. Next day is going to be surgery day. Okay. Then right before surgery, we're going to talk again, answer any last minute questions, and do all the markings. And then you're going to get a call from my post-op team on post-op day 1. That's going to be virtual, just to check on you, make sure you're doing okay. And then when you come in for post-op day 5, that's with me. You're going to see me here in person as well. Okay. Now, then we have a follow-up appointments at 6 weeks and 3 months. Okay, those are typically done virtually for those of you that are not in town. However, if you're in town or simply you just want to come back, yeah, please, we'd love to see you in person as well. And that's going to be the 6 weeks and 3 months. Okay, typically, if those are done here in the clinic, they'll be done with me here in person. If they're done virtually, it could be me or it could be one of my staff members. Okay, but having said all that, we are always here for you at all times, right? We have someone on call 24/7. And we have our Clara text messaging system, which basically works round the clock as well. So it's just a matter of asking, right? You have a question, just ask, and we're there for you. If you want to talk to me, just ask, and we'll make that appointment. Okay? The one thing you can't do is just show up, right? I'm super busy, all right? And I love it. I love all you guys, but I'm extremely busy, right? I'm doing surgery, I'm seeing pre-ops, I'm seeing post-ops, and all these things, right? I'm running the practice. So you can't just show up, right? You have to make an appointment, but we're happy to do that for you. We can get it scheduled. We'll look at my schedule. We'll look at yours. We'll find a time that works. And I'm happy to see you or talk to you or do a video at any time.
All right, let's do some rapid fire questions. We're running out of time here.
Already? Oof,
so many questions. So let's see.
We've gotten through quite a bit today, though.
Yeah.
I think you guys should be happy. Like we did this for you.
Yeah, be happy. Okay. Do you take clients from Australia?
Definitely, and you wouldn't be the first one if you end up coming. We've already had clients from Australia. So yeah, I would love for you to come.
Let's see. When do the massages start after surgery?
So if we're talking about, for pretty much anything, tummy tuck, Lego 360 BBL, you should get your first massage the very first day after surgery. So you have surgery day, post-op day number 1, you're getting your massage.
Do you recommend doing a tummy tuck, Lipo 360 BBL together or separate?
I highly recommend separating out those procedures. I always recommend doing the tummy tuck first and then coming back 3 months later to do your Lipo 360 and BBL. That's what's going to give you the best results in the safest possible setting. And I'm talking about results that are going to last for the long term.
Let's see. What's the cutoff age for a facelift?
Oh, so we have to ask Dr. Vidal that. She's the one that does all the facelifts here. But I don't know if there's really a hard cutoff. It's really all about your health. What type of medical condition you're in. So if you're very healthy and you're whatever in your 70s and you're able to get your labs and your clearances from your primary care doctor, then that shouldn't be an issue.
Should I do BBL or tummy tuck first?
Tummy tuck first. Always, always, always. Always do your tummy tuck first.
All right, let's do a few more questions. What's the best way to fix bottoming out with minimal scarring?
Okay, so that's a good question. So when they're talking about bottoming out, just for those of you who may not know, they're talking about the breast implants. And so the breast implant kind of settling too much and then basically bottoming out towards the lower part of the breast. And so the nipple position kind of stays up here. And there's basically too much breast tissue underneath the breast. And that's what we call bottoming out. And so what needs to be done is the implant needs to be brought back up. Okay. That could be done through whatever incision was used previously. So if it was a breast aug, it could be done through the breast aug incision. If you had a breast lift, it could be done through your breast lift incision. So it doesn't necessarily require additional incisions, okay? But a lot of times what it may require is the use of a mesh, okay? So an internal bra. Or if there was a lot of bottoming out, then yeah, it may require removing the excess skin, which typically means then you're gonna need a lift, okay? And for the most part, that lift is going to be done in that that anchor type pattern, that wise or anchor type pattern.
Thank you. Okay. Do you have a nurse for hire for post-op care?
Oh, well,
That's a
send us
good
your info
question.
so we can keep it on file. But right now we're pretty good with staff in terms of the post-op care.
All right. So last question. All right, we got to get going. Is it good or bad to have incisions reopened during massages?
Okay, so I do understand there's a little bit of controversy regarding that. Typically, you don't necessarily want the incisions to be reopened. It is one of the reasons why I use the drain, right? Because the drain basically stents open the incision, if you will. And so I know that for a fact that for those first 5 days, the massage therapist is going to be able to push that fluid out through the drain, and that it's not going to quote unquote close because there's a drain in place, right? If that makes sense. So having said that, is it possible to reopen an incision if you really need to because there's fluid accumulation? It is possible, but that should be done under the guidance of a medical provider, right? So the guidance of the surgeon or the nurse practitioner, and it also should be done in a sterile kind of clinical setting, right? So you want to do it in a sterile clinical setting under the guidance of the provider to make sure that there's no undue risk of infection when you do that.
Thank you very much.
That's it.
Yes.
That's all.
Sorry we couldn't get to all the questions, everybody.
Oh man, but we tried today.
Yeah, we
today
did.
We really
You were
tried,
going
guys.
quick.
All right, awesome. Well, thank you so much. I love the fact that you're all fired up, that you're throwing these questions at me. I am here typically every Wednesday on Hump Day with Dr. Alex Earle. Remember, next week will be our final Hump Day of the year, okay? And we're going to give you all of our stats. All right? We'll see you then. Take care.